Okay, good afternoon, everyone. Welcome to FHCA's webinar, 100-Day Crisis, the Truth About Employee Turnover in Senior Care. I'm Kristen Knapp, Senior Director of Strategy and Communications for Florida Healthcare Association and your moderator for today. And our presenter is Chris Magleby, CEO of Pinnacle Quality Insight. Before we get started, I want to go over a few housekeeping items with you. To help our program run smoothly, we want to remind you that all attendees are muted due to the large number of participants. We encourage you to use the computer audio rather than a telephone to maintain the sound quality. We also want to encourage you to ask questions throughout the presentation by typing your questions into the question box. And the slide you see now will show you how to use the question box throughout the webinar. The webinar is being recorded, and an online archive will be available to you on the FHCA website, along with additional handout materials. And if you have a colleague unable to join us today, please encourage them to view the recorded webinar. Today's program is being brought to you by the Caregivers Florida Career Program, and this is the CMS-funded grant program that FHCA's Education and Development Foundation is sponsoring in partnership with the State of Florida Agency for Healthcare Administration. If your facility is not already signed up as a participating provider for the Caregivers Florida Career Program, you can sign up through the website that we've got listed here, florida.carefortheaging.org/employers, to access our free resources, which include connections to job seekers, use of an employee satisfaction survey and resulting data, job posting and resume searches via our online long-term care career center, recruitment promotional tools, additional webinars, and more. And then if you have questions, my email address is also there, and we can help you with navigating this program. Okay, now we're going to go ahead and get started, and Chris, we'll turn it over to you.
Okay, great. Thank you. Well, I'm really happy to be here with everybody today. I've been looking forward to this, and of course, that meant yesterday I came down with a cold. So I am got some Dayquil in my system. I got a lot of water. I got some tissues, but my voice isn't always this scratchy. But I think I'll get through this. But I really appreciate the invitation to come present to you all. I was out at the convention in Orlando and I had a great time. I got to meet a lot of people. We danced to some 80s music one night, which was real enjoyable. And so anyway, thanks for joining today. I think this is a topic that is very important and very urgent, and hopefully we can illuminate some things that will help you with some of your workforce issues. I talked to a lot of people in this sector, and almost everybody is dealing with a workforce shortage, and that seems to be the #1 problem that almost every long-term post-acute care provider is dealing with right now. And so first of all, we want to say thank you to all of you, and thank you to your staff members for doing such a good job with your residents, even in kind of a difficult situation where a lot of you are working short. Please pass on our thanks on behalf of everyone in the sector and everyone who cares about people who are affected by this. So we really know that our caregivers have gone above and beyond during the pandemic, gone above and beyond during the workforce crisis. And I want that first and foremost, I want to make sure that you guys really tell your staff how appreciated they are and how great of a job they're doing. So on that note, I was at a concert, I don't know, maybe about a month ago. I'm in Salt Lake City, Utah. So this was a concert here in Salt Lake. And this term actual angels came up, and I'll tell you where it came up at this concert. So Andy Grammer was performing, and he, at one point during the concert, he brought up the staff from a children's hospital here in Salt Lake. This is the palliative care team at Primary Children's Hospital, and had dedicated a song to them, started singing. But one of the people on the stage that's kind of there on the left, she's not a nurse. She is actually the parent of one of the children that is a resident there at this children's hospital, and her child has cancer, and she got a second to talk about these people. And she said, every night we have to leave our, child here in the hospital and we go home and we leave them in the care of these people. And these people are actual angels to us. These people are taking care of our child, and when we have to leave them, and it's a very hard thing. And there's no way we could say thank you enough to these folks that take care of our kids. And that got me thinking about all of you, and that got me thinking about what you do. And I went. One of the things that we do, I guess I should back up and say why I'm qualified to talk about this. I'm the CEO of Pinnacle. We do customer satisfaction surveys and we do employee feedback surveys in long-term post-acute care. And so when I saw this concert and I saw this recognition that these workers at this children's hospital were getting, it really made me think about you all and about our clients. And I started kind of reading through some comments from some of our customer satisfaction surveys where we're talking to residents, we're talking to family members, and these are a couple that I came across. So I'm just going to read these to you real quickly. This is just a small excerpt of some of the things that residents and family members are saying about the staff members that are taking care of them. This first comment said, she was very sad when she first got there. This is someone talking about their mom. She thought this was the end of the line for her. 3 or 4 staff members welcomed her and they were very encouraging. One of them got eye to eye with my mom as she was starting to tear up. And that staff member had such an optimistic demeanor and attitude. That assured my mom and it assured me. The staff, this is a different survey. The staff are caring when I need help that's embarrassing for me. They show me integrity. They're empowering me. Let me do what I'm capable of. I just appreciate the fact that they're loving on my mom. I can tell by their actions and the tone of voice that they genuinely care about my mom. It's the fact that they continue to love on her and treat her like a human being. I tell everyone, every person at the facility is someone's mom or dad. How would you like your mom or dad treated? They do a great job of that. They really treat my mom like a human. And, just like at this concert, this woman was talking about leaving her child in someone else's care. You have all these people they're leaving their parents, they're leaving their loved ones in your care. And you can see these are just a couple comments. We have literally hundreds of thousands of these of how much people appreciate you and they appreciate your staff. And they, your staff really are actual angels that are taking care of people when family members can't do that. I don't think I need to tell you that. I think everyone knows that. A lot of people that are in this industry and that have chosen this profession are doing it because they have a calling to this. There's something that inside of them wants to help others, that cares about the elderly, that cares about our seniors. And I just hope everybody knows how important your staff members are to society, how important the impact that they're making, and that we need to do everything we can to take care of them because they're taking care of our frail and our elderly. And a lot of times, we kind of get in the monotony of this is a job, we show up, we clock in, and we're making these people that are your staff members, to a lot of people, they are actual angels. And when I'm going to talk about a lot of data, a lot of stats, a lot of strategies, some tactics today, but this is the first thing I want to talk about. I don't want to lose sight of that these people are actual angels. And then this last comment really kind of summarizes the problem right now. This person said, things are changing right now. A lot of good people that were here aren't here anymore. I don't know what is happening right now. I've asked and no one seems to know what's happening. We just lost one of our favorite nurses. Something made her quit. I'm not sure what, and I'm not happy. And this sentiment is kind of echoed throughout the whole country. There is a lot of turnover. There's people leaving their jobs. The pandemic was very difficult on health caregivers. You guys know that it was very difficult on you. Now there's a workforce shortage across every sector in the US. There's the great resignation is happening. Everybody's leaving their jobs. And we need to try to figure this out, see what we can do to try to help, because it's really having an effect on a lot of people. It's affecting our employees, but it's having a big effect on our residents and family members. And so let me just show you, there's a couple pieces of data here from resident satisfaction surveys that are interesting. This is satisfaction levels. This graph shows uh, resident and family satisfaction levels at 4 different types of care providers. The top line is independent living. The next line is assisted living, and that green line is short-term SNF. The one down below it is, excuse me, the green line is long-term skilled nursing. The gray one at the bottom is short-term skilled nursing. So if you look at that green line of long-term skilled nursing, you can see that we kind of, before the pandemic, we were floating around at the high 80s, 87%, 86%. This point right here is the start of the pandemic. It's kind of interesting because as soon as the pandemic started, customer satisfaction rates actually went up. That's a little counterintuitive to what you would think, because the pandemic was so difficult on the elderly population, so difficult on people in nursing homes, people in assisted living. But at the very beginning, people were very grateful to their care providers, and they were grateful of your response. That's one thing that I hope that you can take back to your staff members is, now that we've gotten through this and we're kind of at the tail end, and things are looking up, we appreciate your response to this very difficult situation, and your residents and family members appreciate it. You saw it in the spike in customer satisfaction levels. As the pandemic started to wear on, you saw the levels start to come back down a little bit. They got back down to normal, maybe even dropped a little bit because of some of the visitor restrictions. But then there's an interesting thing that started to happen in 2021. This inflection point right here, you can see independent living and assisted living. They always kind of had mirrored each other in satisfaction. Independent was just slightly higher. But then in the halfway through 2021, you see skilled nursing, assisted living separate from independent living. Independent living starts to go up, and assisted living starts to dip. Skilled nursing starts to dip a little bit. You can see that on the tail end of into 2022. And really what happened right there in 2021 is you started to feel the effects of the workforce shortage. That's when the Great Resignation was happening, and we have access to a lot less workforce. And the reason that did not affect independent living as much is because those residents don't have the same interaction with staff members that assisted living needs, and especially skilled nursing needs. And so you see a separation in satisfaction levels. And what's interesting is satisfaction levels right now are actually lower than at any time during the pandemic. And you think about how challenging the pandemic was. You think about the all the PPE, all the barriers up in facilities, the visitor restrictions, how difficult that was on our elderly population. And right now, their satisfaction levels with their care providers are actually lower than they were at any time during the pandemic. And that goes to show how difficult the workforce shortage is on residents and family members. And I don't need to convince you of that. I know you guys are feeling the pressures of that, but I just want to show you the effect that it's having. This is a very serious, very difficult challenge, and customer sentiment is reflecting that. So the other thing is, a lot of your residents, they don't understand this. This is an excerpt from a survey conducted in 2021, last year. Someone says, they keep telling me they are short on staff. Damn it, hire some more. Your residents don't necessarily understand a workforce shortage. Excuse me. They understood the pandemic. As difficult and as scary as it was, they understood what was happening. Your residents, for all of their life, there has been a job shortage. There's been more people than there has been jobs, and it's sometimes been difficult to get a job. For them, understanding now that there are actually more jobs than there are people, that's a foreign concept to them. They don't understand it. So just like this comment, we'll just go hire more people. There aren't more people to hire. And so that's definitely one of the things that I always tell people when I'm talking about this. You need to explain to all your new admissions and family members that how difficult it is to find staff right now, and that and tell them all the things that you're doing to find staff. If they know somebody that's looking for a job, send them your way. You need to set expectations that we don't want to give excuses and say that, we're always working short and cut us some slack. Sometimes you need to set that expectation. You need to know that your residents and their family members need to know upon admission that we're dealing with a workforce shortage, especially in healthcare. There's not enough healthcare workers. It's turning into a crisis, and we're doing everything we can to help with this. But your patience is really appreciated. If it works for the restaurants, you go to a restaurant, you're going to see a sign on the wall that says, "Hey, we don't have a lot of staff member. Please be patient with us as we, wait times might be a little longer than normal." If other industries can do it, you guys can do it too. Set expectations. It's really important that they know that. Okay, so I'm going to get into some stats about employee turnover. So one of our platforms is called Retain. It's an employee retention platform that's based around employee feedback. The way that it works is that platform connects into the payroll system or into the HRIS system, the HR data system where all the employee data is kept. We connect into that system, and then we start communicating with the employees. Because we're connecting into those systems, we have access to a ton of employee data. And so we have access to about 350,000 different employees through this system, and we've been able to see some of the trends in this sector. Our clients are exclusively long-term post-acute care providers, and so we have a real interesting insight into some of the data because we have access to so much data across the country. And one of the things, this is not our data, this comes from American Healthcare Association, and they're pulling it from the Bureau of Labor Statistics. But one of the things that we want to point out is in the pandemic, we've lost almost 240,000 jobs due to the pandemic. And that means, our workforce was about 1.6 million before the pandemic in nursing homes. Now we're down to about 1.3 million people working in this sector. And that is very taxing. I know you guys are feeling that, it's a hard thing. It affects everyone. This is one of the reasons that I talk about this. So I want you to go back to your staff members, tell them, we know this has been hard on you. It's been hard on everybody. It's been hard on the residents. We appreciate you so much. We appreciate you sticking with us, because about 16% of caregivers did not stick with us and have left the profession. And those that have stayed in the profession are sticking with it, are taking care of our frail and our elderly. Just let them know they're loved, let them know they're appreciated. We appreciate it so much. So like I said, we have access to some of this turnover data, and some of it is very, very interesting. This graph is maybe one of the most important pieces of data that I'll show you today. And I hope that this lands and you understand what we're looking at. This is the tenure of separated employees during 2020 and 2021 by 100-day segments. So we looked at the tenure of people of when they left their job, and we wanted to know what their tenure was at their job when they left. And you can see that there is the majority of turnover that's happening in the sector is happening in the first 100 days. So people who have a tenure of 100 days or less are accounting for almost 40% of all turnover. And then it drops down quite a bit as you get into people whose tenure is 200 days, and then it starts to really decrease. And so what this data is showing us is that we are experiencing, like, the majority of employee turnover that's happening is happening in the first 100 days. And most caregivers know this, most operators know this. They don't actually know the stats, but just talking to people, they see, you know what, we're hiring a lot of people and a lot of them aren't making it right out of the gate. And we know we have a problem with new hire turnover. They just don't know the extent of it. And the interesting thing is, this problem is a little bit unique to our sector. There's this good news and bad news. On the left-hand side, this graph is showing, this is published by Harvard Business Review, and this is showing across every sector in the US. This is, these are all US employees. When do people leave their jobs? And you can see that there is a little bit of a spike in the first 3 months. Everybody has a little bit of new hire turnover problem. But the big spike happens at the 1 year mark. and then turnover starts to go down, and then there's another spike at the 2-year mark, and then after that, turnover goes way, way, way down. But all throughout those 2 years, turnover remains relatively high. There's spikes at that 3-month, 1-year, and 2-year marks, but turnover is a problem all through people's first 2 years of tenure in their job. And this is across every industry in the United States. When we look at the long-term care average, this is the average of assisted living and skilled nursing facilities. So this is long-term care, residential setting. The graph looks very different. That huge spike is just happening in the first 3 months. And then you see it start, and then it just crashes down. And after you get to about 6 months, turnover goes way, way, way down. So what this is telling us is we have a huge problem with new hire turnover, but if we can usher people through those first 3 months, their chance of turnover starts to dramatically decrease. I've got a friend who works for an investment bank, and they know this stuff on the left-hand side. They have initiatives that they need to keep their people for 2 years, because if they can keep their employees for 2 years, then they have them for a very long time. And so all their initiatives are based around keeping their new hires for 2 years. Well, in our sector, we don't need to do that. We need to do that for 3 months. If we can keep our people for the first 3 months, then their chance of turnover starts to really plummet. We're going to retain them a lot easier. So our initiatives, unlike the investment bank, doesn't need to be for 2 years. Our initiatives need to be built around that 3-month mark. That's about 90 days, 100 days. If we can keep people through those first 100 days, we're going to have a very big win. Okay, so this is the percentage of people who are leaving their job before day 100. And you can see that the pandemic really exacerbated the problem. In 2019, we were losing about 30% of our new hires before day 100, and now it's gone up to just under 40%. And so, to be honest, 30% is still a high number. This has always been a problem. 30% of your new hires leaving before day 100 is a big problem. Now it's up to 40%, and I've seen some operators who are around 50%. So on the national average, we're at about 40%, but according to different markets and different sectors or different segments of markets and geographical areas, it can vary quite a bit. But definitely on a whole, as an industry, we have a new hire turnover problem. And so identifying that problem and then figuring out exactly what we can do is very, very crucial. So the good news is, through this data that we've collected and through some initiatives, we found things that work. And so that's what the rest of my presentation is on today. And the first little while there, I want to paint the picture. I know you guys are feeling the effects of the workforce shortage, but I really want you to understand what exactly it is, how it's affecting the residents. We talked about the resident satisfaction levels and what the makeup of this employee retention problem is. We're able to retain our longer tenured employees a lot better. It's the new hires that we're having a very difficult time keeping them in the sector and keeping them on the job. And so how do we fix this? The good news is there are some strategies you can do to fix this. The first thing is we need to know what that solution is. So if we want to help with the workforce problem, we need to retain our staff a little bit better. And the way that we can do that is we need to keep our staff with us for 100 days. So one of the things I really recommend when you leave this session is that you go back, you put an initiative together of how are we going to keep our staff with us for 100 days. All of our new hires, we want to make sure that somebody's there ushering them through that 100 days, that if they have any problems, they're comfortable coming to us, that we're going out of our way to really try to keep our new hires with us for 100 days. Because if you do that, those people's chance of turnover goes way, way, way down. If we just look at the data, we want to use the data to our advantage. We want to go after the low-hanging fruit, and the low-hanging fruit is this group right here. This first column, the 100-day people, that is where the majority of turnover is happening. And if we want to implement an employee retention program, it needs to be built around that group, because that's the most efficient way to spend your time and to spend your money and to spend your effort with an employee retention plan. I think it's great what the association is doing, that they've got this grant, that they've got some resources for you. They're trying to broaden the hiring pool. There's three ways you can deal with workforce issues. You can broaden the hiring pool. You can use technology to make your staff more efficient with less staff. And that's oftentimes very expensive to do, to bring in different type of technology to make your staff more efficient. Some providers have been able to do that, to bring in some new technology. The third thing that you can do is to retain your employees. Retaining your employees is one of the more cost-effective ways to address this. These other two can be very expensive. And I know with the grant, there is an initiative on widening the hiring pool, trying to recruit more CNAs into this sector. And I think that's great. And that is definitely something you need to do. And then the other part of their plan is to help with retention. And I know the association is doing a few things that you can do to help with retention. And I would, if you're attending this webinar, I highly recommend you take up, you partner with the Florida Healthcare Association to help you with some of those things, because it's a very valuable thing that they're offering. Here's some other things that you can do in conjunction with this grant that they've got for you. These are some of the things that you can do to help keep your new hires through the first 100 days. So I'm going to go over 5 strategies that you can deploy. The first 5 are really kind of tactical. These are things that you could start doing tomorrow. There's things that are fairly simple, things that you could create initiatives and start doing. The 5th one is something that takes a little bit of time. It's working on your culture. That takes effort, that takes a lot of work, but it's very, very powerful. Of all the things that I talk about, this 5th strategy of creating a culture of love is very, very powerful. But it's not something that you can just change overnight. It takes a little bit of time, but I'll get to it. I'll talk about it. I think it's very important and impactful. Okay, the first thing that you need to do when you're trying to keep your people through the first 100 days is you have to create your strategy. What is your 100-day strategy? Okay, so when you're creating that strategy, there's a few key items that are really important that we always recommend people do. First, you need to set expectations with your new hires about the first 100 days. I work in feedback. We're always gathering feedback from employees, and we're gathering feedback from residents and family members. One of the things we're always finding out through those surveys is the people who set expectations have better results than the people who don't. So I'm always teaching people you need to focus on setting expectations. I talked about when your new admits come in, that you talk to them about your workforce challenges, that you talk to them about this could affect how long it takes for someone to answer a call light. These are the things that we've done to try to help with that, but really there's no substitute for having a full staff, and right now we don't, and we're trying to get one. The same thing needs to be done with your new employees. You need to set expectations. As soon as someone takes the job, someone in HR or someone in management needs to tell them, look, your first 100 days here are going to be the hardest time of this job. There's a lot that you're going to have to learn. There's a new EHR system you got to learn. You have to learn a new scheduling system. You've got to learn our culture. You've got to learn our mission and values. You've got to learn how we do things. You've got to, kind of understand the work dynamics of dealing with different people and how the different departments interact with each other. And it's a lot. It's a sharp learning curve, but we're here for you. We are going to help usher you through this time. And if at any time during those first 100 days, you feel like this is not for you and you want to quit, come talk to us. because a lot of people feel that way, but once they get past those first 3 months, those feelings go away and they start to really get the rewards of working here. One of the reasons we work here is because it's very rewarding to take care of these people. It's very rewarding to build relationships with our residents. But the first 100 days are, maybe you'll question that a little bit. Is this really worth it? We know it's worth it, but there is some challenges that we're going to help you through it. The second thing you need to do after you set expectations is you have to measure how many of your employees are staying through the first 100 days. All you've got to do is you count how many new hires you have, and you count how many people make it to day 100, and that gives you a percentage. You start tracking that percentage, and you want to see that percentage increase. You know, if you're at average right now, that number is going to be 61. 61% of your new hires are going to make it to day 100. 39% are not going to make it. So start tracking that number. And once you have a baseline, you can compare it to national average. It's one of the things we provide to our clients is we give benchmarks about how they're doing. But just so you guys know, write that down. 61% is the national benchmark in nursing homes and assisted living of how many people make it to day 100 after they're hired. So track your number, compare it to the national average, and try to then set goals to increase that 100-day retention. If you start and you're only at 40% of your new hires are making it to day 100, well, let's set a 3-month goal that we want to get it up to 45%. We need to start seeing some increased 100-day retention. The other thing is, if any of you are reporting up to a regional director or into the C-suite or something like that, or if you have to go to board meetings, if you can demonstrate this, if you can show how you've put in employee retention plan, and you used to have 60% of your new hires were making it to day 100, but now 70 or 80% of your new hires are making it to day 100, and that is increasing your employee retention, that is huge to them, because employee turnover is expensive. Every employee that you lose costs about $4,000 to replace them. So every employee you can save saves the organization about $4,000. So if you can put this plan together and go and show somebody the improvements that you've made, you know, you're going to be a big hero to the organization, because you're saving a ton of money and a ton of headache and heartache to the organization. So it's definitely something that's very valuable, and you can, this is an easy KPI to track. How many people are hired? How many people make it to day 100? And if you can show improvement in that by this strategy that you put together, it's very valuable to the overall organization. Okay. The other thing that we recommend is that you assign a team leader to oversee this initiative. Pick somebody on the staff. It's usually going to be someone in HR. If HR staff isn't big enough, it can be someone in management. Somebody needs to own this. Look, we have a problem with workforce. I laid out how much workforce is affecting resident satisfaction, how much it's affecting staff morale, how much it's costing the organization. It's worth assigning a team leader to oversee this initiative and have somebody who owns this and says, I'm going to own this, and I'm going to own this KPI. We're going to start keeping our people 100 days, and we're going to improve our retention percentage and track it over time. Very, very valuable to the organization. Okay, so the first thing is create your plan. The second thing you need to do is focus on onboarding and training. No day is more stressful than your first day. Okay. Onboarding and training. Again, set expectations. Let them know it is hard in the beginning, but it gets easier. You know, let your folks know that after they get through this time period, things get much, much easier. They get a lot more comfortable. One of the things that I want you to ask yourself is, are you rushing past the onboarding experience? A lot of us, because we're working short, we need to hire new people and we need to get them out on the floor immediately. So we're skipping some of the onboarding. When we do our employee feedback surveys, the #1 correlated question to staff tenure is how they rated the onboarding and training process. If they rated it poorly, there's a high likelihood of their tenure being low. If they rated it highly, there's a high likelihood of that employee staying and having a long tenure. Nothing is more important to employee tenure than the onboarding and training process. You cannot bypass the onboarding process to get them on the floor because you're working short. If you do that, you start creating a vicious cycle, and those people are going to quit. So you need to make sure they're getting properly onboarded. They can mirror somebody else, that's okay. But don't skip onboarding and training just to get them on the floor because you don't have enough staff. You kind of have to bite the bullet on that and make sure they're getting trained enough. The other thing you need to do is evaluate your training process. Each of you has a different training and onboarding process. And I'm not here to say that one of them works better than the other one. You just need to ask your employees what's working. The best way to evaluate the training process is do surveys and ask your new hires to tell you how onboarding and training went. They are going to tell you, and then you can follow up with them and say, okay, what would make it better? And that's the best thing that you can do to see how you're doing on onboarding and training. And this is a stat from Tiny Pulse. They said employees are 23% more likely to stay if their manager clearly explains their roles and responsibilities. Onboarding and training is very important. It's after you create your strategy, it's the second thing we recommend you start focusing on. The third thing that we recommend you focus on is systematic feedback. You need to be talking to your new hires and understanding how things are going for them, and how they're doing. These are this is a little screenshot of the survey platform that we use. This is when we check in with new hires. You can see we're checking in at day 15, day 30, day 60, and day 90. We're trying to graduate them to that 100-day period, because after that, their chance of turnover goes way down. So at each of those increments, we're just seeing, hey, how are things going? When we do our milestone check-ins, they're very casual. Some of the questions we ask are down at the bottom. These are things we recommend that you ask. Hey, how's your job going? Every time we check in with someone, we ask, do you need anything to be better at your job right now? Those are great questions. Systematic feedback is important. We do it through a survey platform where we're texting and or we're sending an email to new hires. It doesn't have to be through technology. You can have your managers do this. You know, if you don't have a partner to do this, you can have your managers make sure they're checking in and maybe just asking these two questions at these milestones at day 15, 30, 60, 90. How's your job going? Do you need anything to be better at your job? This is really important, and you will learn so much because each person is different. They're going to tell you. I was just reading some results recently, and someone said, you know, things are going well, but the scheduling is very frustrating. This company happened to use OnShift, and OnShift does electronic scheduling. And they said the schedule gets posted in the break room, but then it's also posted digitally on OnShift, and those two schedules don't match up. They're not the same. And so we've got a hard copy of a schedule and an electronic copy, and they're different. That's very frustrating. And they're not posting the schedule until very last minute. And I don't know when I'm working until like Sunday night. I don't know what my schedule is for the week. That's very frustrating. And so then this organization is able to try to start making some changes on that. We've seen other people say, you know, I'm working PRN somewhere else, and I'm having to manage two EHRs, and it's getting very hard. I don't like doing it. So then that company was able to go to that person and say, hey, we didn't know you're also doing PRN. Would you like to pick up more shifts here with us? And then they were able to just go full time with that organization. You're just going to learn all sorts of stuff. A lot of times they talk about, you know, I just need more training. I don't know exactly what to do, and I'm pretty intimidated. All sorts of things you learn just by asking people, what do you need to be better at your job? They'll tell you, and you can respond to it. And when you respond to their individual needs, you're going to keep them through those first 100 days. Also, once you're gathering feedback, one of the things we always tell people when they do any type of survey, you need to communicate back to the people who gave you feedback about what you've learned and what you're doing to try to improve. So if you do any type of customer satisfaction survey, you need to communicate back to your residents and family members, hey, this is what we learned and this is what we're trying to improve. When you do employee surveys, you got to communicate to your employees, hey, thank you for giving us your feedback. This is what we learned. This is what we're going to do to improve. The number one thing you can do to improve your response percentages, how many people are taking your employee feedback surveys, is to tell your employees what you've learned and what you're going to do to improve and what things you're doing well. If you tell them that gets them motivated to keep participating in your surveys. So they're giving you feedback. You've got to complete the circle. You've got to communicate back to the employees what you've learned and thank them for participating. Individual follow-up, I kind of talked about that, of solving those individual needs that you're going to learn as you have the systematic feedback process in place. One of the cool things about systematic feedback is the people who respond to new hire check-in surveys are 50% more likely to make it to day 100. So I showed you earlier that 40% of new hires are quitting before day 100. Well, people who respond to new hire surveys, only 20% of them quit before day 100. And so that's very, very helpful for your organization, because by getting them to respond to a new hire survey, they're twice as likely to make it to day 100 because they're invested in giving you feedback in the process and you can respond to that feedback. So it's something that's really powerful. It's kind of a strategy to reduce your new hire turnover rate, is getting them to do these new hire surveys, whether that's in person with a manager or whether that's through a technology platform partner like us that does the survey for you. Okay, the next thing is employee recognition. Employee recognition is very, very important to building culture. Recognizing new hires for some of the stuff that they've done is a great way to keep them through their first 100 days. So when you think about employee recognition, this is mission critical. This is not going above and beyond. This is just as critical as everything else that you're doing. You have to have a systematic approach to recognizing employees. One of the things that we recommend is that if you have an initiative to keep your employees through the first 100 days, well, then once they make it to 100 days, they need to be celebrated. So we definitely recommend using that as an opportunity to celebrate people. I know a lot of organizations celebrate people at their year anniversary marks and at their birthdays. So we would just add in the 100-day marks to this as something to celebrate. And then also anytime staff members or residents and family members recognize another staff member, those people need to get recognized, whether it's in a stand-up, whether it's in your coffee meetings, whether it's in this the monthly staff meeting, whatever it is. You got to make sure you're recognizing your people who are being called out for excellent service by staff members or by resident and family members. Those are really easy ways to recognize your staff. You've got this is a key part to keeping your staff on the job. Look at this stat, another stat by Tiny Pulse down here. Employees are 2 times more likely to be looking for a new job if they don't feel recognized for good work. This is something that is easy in our industry because everybody is going out of their way to care for somebody who can't care for themselves. Everybody deserves recognition for doing that. We have this care-based mentality, and people need to be recognized for the care that they're performing, even if it's not individual recognition is the very best. But some of the things that I talked about today, about how customer satisfaction levels actually improved at the start of the pandemic, about how people have stepped up during the workforce shortage, about how people have stepped up during the pandemic. You've got to go back and recognize your staffs for this. You've got to tell them how. Remember, I was talking about actual angels. These people are actual angels. They're taking care of someone's family member that they can't do for themselves. And we really want to recognize our staff members for doing that. So recognition, huge part of keeping our people around. Okay, the last thing that I'll talk about is really one of my favorite things to talk about, and it's creating a culture of love. In 2014, Sigal Barsade and April O'Neil published a study called What's Love Got to Do with It? A longitudinal study of the culture of companionate love and employee and client outcomes in a long-term setting. Okay, that's a mouthful. But essentially what they looked at was this idea that they had of love in the workplace. And what that means, they're quick to point out, that doesn't mean romantic love. It means, they talk about this concept that means companionate love. And what is companionate love? Well, companionate love looks like, imagine a pair of coworkers collaborating side by side, each day expressing caring and affection towards one another, safeguarding each other's feelings, showing tenderness and compassion when things don't go well. Now imagine a workplace that encourages those behaviors from everyone, where managers actively look for ways to create and reinforce close workplace relationships among employees. Companionate love means your employees care about each other and they have a connection and they like being with each other, and they have an emotional intelligence and an emotional connection with each other about the work that they're doing. And what they found was really powerful. Long-term care facilities who had this, that tested high for this, these levels of companionate love, where the employees cared about each other, employees who felt they worked in a loving, caring culture reported higher levels of satisfaction and teamwork. They showed up to work more often. Our research also demonstrated this type of culture related directly to client outcomes, including improved patient mood, quality of life, satisfaction, and fewer trips to the ER. Essentially, this is a cheat code for running a better facility. When your employees care about each other, everything gets better. And less people call out and miss shifts, you start having better client outcomes, fewer trips to the ER, higher resident satisfaction, better quality of life, improved patient mood, higher employee satisfaction levels. And so what this means is, the same way that we encourage our staff members to care for our residents, we need to build a culture where they can care for each other. This is one of the most powerful and important things that you can do in your care setting, is help your employees care about each other. Create a culture where they're caring about each other. If you have people that are poisoning the well, as difficult as that is, they have to be disciplined, they have to be coached, and if they can't change, they have to go. Sometimes we have older tenured employees who eat the young, so to speak, in this sector. We have people that have been around for a while, they kind of think they know everything, and they're really hard on everybody else, and they poison this culture. They create a culture that is not loving and is not caring, and that drags everybody down. You have to, as hard as that is, you have to identify who those people are. You have to coach them through that. And if they can't be coached out of it, they have to move on. And so we think that by creating this culture of love, that we can elevate everybody, and we don't have to lose employees, but sometimes you have to. So some of the things that you can do to work on creating a culture of love in your facility is focus on the emotional aspect of work. There's a great quote by Brene Brown in one of her podcasts where she says, "We used to think of ourselves as rational beings who sometimes felt emotions, but now we understand that we're actually emotional beings that sometimes reason." And you need to remember that when you're dealing with your staff. Most of your staff has chosen this job for the emotional aspect. Most of your staff, has a choice to go do other things. They could work in all sorts of different industries. They've chosen this because there's an emotional fulfillment they get from caring for others. That is your biggest asset, and you need to focus on it. The reason that we're doing this is because of the way that it makes us feel. You have to create a culture where the employees feel a certain way, and care for each other. Broaden the definition of culture. A lot of times culture, there's two types of culture, interfacing and other facing. Interfacing are things like, I'm proud to work here, I'm happy to work here. Other facing is my connection with others, how I feel about my friendship with my manager, how I feel about my friendship with my coworkers. Both of those things are very important for culture. Yes, our culture is, we love to care, we love our job, we're proud of our job, we love taking care of our residents, but how we interact with each other is just as important. What kind of emotions are you expressing to your employees? Do you have policies that foster this type of care and this type of love between your employees? Are you creating moments between employees where they can create those type of friendships? Are you bringing staff together in the break rooms? Are you creating moments where they can build bonds to each other? That's very important in creating this culture of love. So, by the way, this study is so interesting. They actually did it. They wanted to prove how important this culture of love is in all workplaces. And their result that they published was how creating this culture of love elevates every workplace, not just healthcare. But they did it in a long-term care setting, and it's got very powerful output. Just Google this. What's Love Got to Do with It by Sigal Barsade. There's tons of articles, and you can read the whole publication is about 85 pages long. So it's pretty long, but there's some excerpts and there's some articles published about it. It's very interesting. It's very powerful. Okay, so in summary, I want to leave just a few minutes for questions if anyone has any. But in summary, we keep your staff with you for 100 days. That needs to be one of your new initiatives as you're working on workforce. You want to measure how you're doing. Remember, 61% of new staff members are making it to day 100 right now. Find out what your benchmark is, start tracking that number, and you can see it, how it's doing compared to that 61% benchmark. And you want to see some improvement, even if you're above that. Even if right now you got 70% of your staff is making it to day 100, there are a lot of things you can do to improve that. And we've talked about those 5 things today. So the last thing is, we do have this QR code here for you that has all the slides, and then it has a little more information from some of our team about this, these 5 items and some of the things you can do to keep your staff through 100 days. So if you're interested in that, I'll leave this up for a second, and you can use your phone to visit our site and download this stuff. But other than that, I'm now open to any questions. So I'll kind of float it back to Sarah and Kristen and see if any questions have come in, and I'm happy to answer them.
Okay, great. Thank you so much, Chris. Really good information that, we've heard a lot of these ideas here and there from employers that have had success with retaining their folks. So I'm glad to hear you reemphasize those and give our folks these ideas. So we just want to remind you, if you do have questions, you can put those into the chat or into the question and answer box. I'm sorry. Let us know if you do have questions about that, whether that's questions about, some of the things that Chris has shared. If you have questions about our Caregivers Florida grant, as Chris mentioned, a lot of retention is a huge part of that. So programs like these are really critical to help, with addressing your workforce challenges, because obviously turnover is significant in terms of your time and your resources. So keeping your people is important. So I'm just going to give it a minute. It doesn't look like we have a lot of questions, but I will say that was some really great information. I liked a lot of those ideas that you shared with our folks today.
Well, thanks. Yeah, you're welcome. I must have done such a great job that there's no questions. I must have already answered them all. I think that's what happened.
What it is. I'm sure that's what it is. So, well, I really appreciate you for taking the time out to speak with our folks today, Chris. I want to thank everybody for participating. I want to remind you that a recording of the webinar is posted on our website under the webinar section, as well as the handouts from today's presentation. And then if you're participating in our Caregivers Florida Career Program, the webinar handouts will also be posted there. If you're not participating, make sure you Get signed up with us. We've got almost 400 providers as part of the program. Jennifer Zolkowski, our project leader, you can see her on the screen. I'm calling her the matchmaker these days because she is going and pulling down the profile of job seekers that are reaching out to us because they've seen our ads, and she is sending those profiles to our participating providers. So you're getting contact information of folks looking for jobs sent directly to you from Jennifer as part of this program. So I definitely encourage you to participate if you're not already. So with that, I'm going to wrap us up. It's Friday. We hope everyone has a great weekend, and I want to appreciate, thank you, Chris, and thanks everyone for taking part today. So have a great day.
Thank you.